So, as part of my blog this month, I really want to introduce you to Alison and Maxime. They want to talk to you a little bit about the integration work we're doing between social care teams, the district nursing teams. Welcome both of you, and thank you for agreeing to talk to me. So I know that you've integrated as teams, haven't you, within the community. How long ago was that when you...
Last year, wasn't it? It was a few months now, yeah.
A few months ago.
Yeah. Good 6 months.
Yes.
6 to 8 months, I'd say.
I always feel when you actually integrate teams, it improves communication, but I'm sure we've achieved a lot more. So I just want you to talk to me about your experience, really, in following the integration of teams.
I think, like I said, it's improved communication between us. We've got a better understanding of our roles and patient care as well, hasn't it? We've been more responsive in our actions. Like before, we'd have to wait using telephone communication, whereas now we're in the same office, we all know each other, and we can talk about cases and just react quickly to them.
So we just go directly to each other now.
Yes.
So if the district nurses come in with something that they've noticed and they've got some concerns, we have a look if the case is open to our team, and then we'd pick that case up and arrange to go and do an assessment, and vice versa.
Yeah.
If we go on visits and notice somebody's like in pain with the legs or bandaging, we go straight to district nurses and they put them down for a visit, so it's great.
Yeah.
And what do you, from a patient perspective, what do you think the benefits have been?
I would say time, really, more than anything.
That waiting time is just
because previously, if we wanted a district nurse referral, we'd either fill a form in and fax it, wait for it to be picked up, or it was a telephone call that would then go to the answer machine, get somebody to ring you back, share the details. It could be days, whereas now it's usually the same day or the day after. So it's great.
It's fantastic, isn't it?
Yeah,
it is. You're far more efficient working together as a collective. I mean, how hard was it bringing the teams together?
I think it's just changing attitudes, isn't it, really, and new ways of working, but it seems to be working really well, doesn't it? It's much better. All the staff have got to know each other, and like I said, the communication is just 100% better than it was before.
Yeah, I think that at first we all sat sort of district nurse, social work team, district nurse, so we've split up again slightly, but we've already got all the bonding together now, so made some good friendships in the team.
We have.
That's excellent. And does it help to understand each other's role? Because I know that having a clinical background myself, you often have a perception of others' roles.
Definitely.
And that's not always the case, is it?
No, it is much easier. We do go out on some visits together and just linking in together, don't we? And it's just working really well. It's like before, you wouldn't really understand for district nurses what the social team did, and the other way around. It's just over the telephone conversations, but now we can see, can't we, what each other does, and have a better understanding and some respect as well for each other than we did before.
Excellent. And obviously we're trying to, when we're going to take the co-location, we've tried to do that really to support the neighbourhoods, the primary care neighbourhoods as well. How's that working in terms of your relationship with the neighbourhoods and primary care?
I think it's really improved, really, because previously the district nurses were over in Ann Street, which is GP health visitors, but we didn't have that social aspect, whereas now we're linking into all physiotherapists, OTs, manual handling, social team, and there's seems like there's a strong link with the hospital as well. So it's all.
And we're involved from the social work side of things. We're involved in the MDCs at the practices. So if they've got a person that's got quite complex needs, we're involved with that conversation and how we can support that person as well, not just from the health side.
Good.
So it works great.
So you wouldn't go back to how you were working previously?
No.
Definitely be 10 steps back.
So what's your next objective? Because you've come together as a team, is there anything else you want to move forward on?
I think from my perspective, more integration with the hospital side. I think that's where there's still a big space at the moment.
think that's the same for us as well,
Yes.
getting that link. People want to be at home
Of
in their own
course.
homes. It's just getting a speedier sort of discharge
Yeah.
for us to take over that care. Yeah.
So that's your next objective then.
Yeah.
Yeah.
So I think that's, you know, I think that's really important. It's making sure that we integrate as teams,
Yeah.
and so it is a seamless system for the patient at the
Yeah.
end of the day.
Yeah.
But thank you very much for talking
Thank
to me. I really appreciate it, and I'm sure everybody will be pleased to hear about